a location change. For many, many years, the crisis intervention program had been operating out of the emergency department at the Good Samaritan Hospital. Now, due to some changes and licensing issues, we found it better to move it across the street from the hospital on 4th Street. So some minor renovations were made to one of the hospital buildings where they still provide us space. Good Samaritan Hospital is still kind enough to provide us space for that. But the location is across the street from the hospital, and I think people will have easier access to get in and won't get caught in the hustle bustle of the emergency department. So we wanted folks to know that that change is occurring. Folks should not present, folks are coming for crisis intervention services, and they provide many services including food vouchers or shelter vouchers or whatever, not to go to the emergency room to receive those services, but to go to the new crisis intervention.
When will this change take effect?
We are working with the state through the licensure process. We're hoping within the next 3 or 4 weeks.
3 to 4 weeks.
It depends a little bit on the process and different waiting for a certificate of occupancy.
Yeah, it's on the other side of the Broderick building, and it was formerly Dr. Denolis's office, if that helps for
That does help. I couldn't remember what physician had been in that office. I want the public to be aware that, you know, they're going to be going a few steps to the west instead of going into the emergency department to get those services.
John, I'm not trying to catch you off guard here and quiz you, but do you have any idea what the percentage of foot traffic for the clients are versus telephone traffic? I mean, how much traffic?
So about 8,527 individual cases through that fiscal year. Telephone contacts were about 5,215. So walk-ins or mobiles, and because of some of the changes, that's a mixed number, would account for the other 3,000 or so.
Are there referrals? That's the only term I can think of, that if someone comes into the ER for something, they're not necessarily coming to report to crisis or to utilize crisis, but they come to the ER and the ER staff will direct them to crisis because of the nature of their visit, and then will this, in this case with the relocation, will the hospital escort someone maybe over, I mean, I know it's only 500 feet, but you don't want to lose anybody in that 500 feet,
We are working actively with the hospital administration and the emergency room staff to work on those details.
Okay.
We will still use the emergency room. If someone needs medical clearance for an inpatient hospitalization, it's done in the emergency room. If someone reaches a level of aggression that they can't be seen in an outpatient facility, they'll still be seen in the emergency room.
Mm-hmm.
They are still working with their staff on exactly how the communication will go. If somebody presents and says, I need help, it's a very different procedure they have to follow than if they say, I am here looking for the crisis intervention counselor.
The county has a contract with Philhaven to provide those services at the Good Samaritan Hospital's site. Jessica is our liaison to the crisis intervention program, and as I mentioned earlier, Dr. Brickley has oversight of the crisis intervention program. It's primarily funded by county agencies. We're the liaison agency. Community Action Partnership provides a great deal of funding for crisis intervention. Children and youth, drug and alcohol engaging still is providing some. So it's a collaborative effort. We all work together to make it work. Another change that we've had, not necessarily related to the relocation, is that our goal is to increase mobile crisis intervention, so that not everyone needs to come into the office, but that there will be more on-site crisis intervention going on. We think that's much needed, and we're trying to increase that as well.